Hey y'all, it's me, Stephanie again. I'm 1 week and 1 day post-op. I have a lot to put in this video, so I don't know how long it's going to end up, but I think it'll be pretty interesting because I've had a very interesting week, very interesting uh, surgery, and I have a lot to say because I haven't been on in a week, and I was really hoping to have like a daily thing with a video so you can see me like, but uh, that didn't happen. So we're gonna backtrack a little bit and start with this video. So once they got me back and did all the pre-op things, adding the IVs, all the testing, the pee in a cup, blood work, all that other stuff, change your outfit. Um, they asked a lot of questions, blah 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 blah. Let me tell you something. One thing that scared me, and I was like, okay, I'm leaving. A nurse came in and she was like, let's go over some of your allergies. Okay, that's fine. And she's listing all these allergies. Blah, 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 makes you nauseous. Blah, 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 gives you hives. Blah, 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 breaks you out. And I'm going, I don't have any of those allergies. And she goes, well, oh, I'm sorry, I was on the wrong patient. And I was like, oh, no. Uh, okay. So that was kind of scary. But she got back onto the right page, and it seemed to go better after that. Uh, they let the family come in, gave us some time to, hugs and kisses and cuddles and say a prayer, and then it was time to whisk me off. And I did not take anything for anxiety because I have a lot of anxiety anyway, and I have anxiety about anxiety medicine. So it would not have helped, I don't think. And I much rather would have just been with it and then just be put down faster. I don't know. Um, the the like transport person came. My parents and the friends left. My cousin was there, and he was wheeling me down to the OR, and I'm completely with it. And I'm going into this OR, and I'm looking around, and it's cold. It is so cold in there. And they had music blaring. It was like a party, and which was cool, kind of relaxing. I'm like, okay, y'all are jamming. I can deal with this. And uh, I was looking around the room, and they're introducing everybody. Stephanie, this is so and so. And they're all gowned up and face mask, and all I can see are like their little eyes, and they're like, hello. And they had a bunch of tubs of I forget the name for them, but they look like little scissors, but they clamp. and they had, oh, a ton just lined up one right after the other, and there's just a lot of equipment, a lot of people, a lot of lights, and it was cold, and I just just did everything they said, just try to take a deep breath. They said, come on, scoot over here to the OR table, so I scooted over there and laid down, and they make you comfortable before they put you down. They gave me a pillow and warm blankets because it was freezing in there. I had my little elephant Ellie, and they gave me the mask. They said at first it's just going to be plain oxygen. I said, okay. I said, well, tell me before it's, the knock you out medicine. And I guess it was the anesthesiologist or one of the nurses that was standing there next to me. And I was like, can you hold my hand? And so, he held my hand, and they said, okay, here it comes. Take a couple deep breaths. And took a deep breath and didn't really feel any different. Took another deep breath, and I just started tingling, just and I took one more deep breath, and it was like extra tingle and gone. So that's how it was put to sleep. And then I'm sure they took all the blankets and pillows off and laid me there butt naked for 6 hours. Because, yes, the surgery lasted 6 hours. 6 hours and 10 minutes. Uh, my mom was telling me they give you like that little thing at like Applebee's. And, when they're ready to talk to your family, they'll buzz you and your family has to come running back over. Well, they told mom and dad, this is going to be probably about a 5 hour surgery. And so mom and dad, about 2 hours in, they go to get something to eat upstairs in the cafeteria. Now, mom had already gotten lost once that day. So we're up in the cafeteria, and mom said that little buzzer starts going off. It's vibrating, bzz, 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 and lights are going off. And so she's thinking, what happened? Oh my goodness, what happened? And so she said she's like running through the hallway, like, is this the way to the OR? Is this the way to the OR? And she finally gets down there, and they tell her, oh, we just wanted to update you, wanted to tell you that we finished the front procedure, and we're gonna getting ready to flip her over and start on the back. So she was like, okay. So yeah, they'll update you, and just stay calm. If you got family going, just tell them it's okay. Just stay calm. And um so then the first thing I remember, I just remember like blinks of things. So like in recovery, I remember like a blink of looking up and seeing someone sitting over there, and like a blink of someone putting an ice chip in my mouth. Just little tidbits, just seconds of memory. Uh, Thursday night, it was a 6 hour and 10-minute surgery, and I was in recovery for 4 hours. I was required 4 hours. They said they had trouble ventilating me because I am a little bit more fluffier than some people. And so when they laid me on my stomach, they said it was a lot of pressure on my lungs, and that they had to use a lot of extra oomph and pressure to keep me breathing good. And just, with my fluffiness, it took just a little extra time, which is why it took 6 hours instead of five. But then Thursday night, I ended up in a room. Mom and dad said that they got me up in a chair that night. I think mom even said they took me for a walk, but I don't remember that. I don't remember anything of Thursday night. But here's a couple more pictures, and then we'll talk about that. I had asked the doctor about some questions during surgery. I'm definitely not in recovery. This is after I came to, but a couple days later. But one thing, because I ended up getting these really bad bruises here on my wrists, and he said what they used was what's called an A line, and it's something that goes right into your arterial vein, and it monitors your blood pressure with every heartbeat, which I thought was really cool because with the surgery they did for me so that I wouldn't lose so much blood was they did a hypotensive type surgery where they medically lower your blood pressure. So it was really neat to know that they have that kind of like stuff. I also asked him how much blood I lost, and because we were worried about that, I did a lot to try to, I took iron beforehand, trying to build up my blood, and we were trying to take all kinds of precautions. And he said I only lost 250 milliliters, which is half of this bottled water. And he said normally they lose 500 is average, which is this entire bottled water. So they did pretty good, I think. But I thought that A line was pretty cool. Gives you a lot of bruises though. One thing that was good when you go from the recovery room to your room, you're already so sore. What they've done now at a lot of hospitals, and what they did this at this hospital for me as well, is when you're in recovery room, they put you onto, like after OR, after your surgery, they put you onto a regular bed, and that is the bed that you remain on even when you go up to your room. So you're sitting in recovery and laying in recovery in that bed, and they just wheel your bed up to the room, and there's not that additional pull you to another bed. It's just you just keep chilling in that same bed, which is nice, very nice. Post-op, I had a lot of, I think I counted 9 different things either coming in me, out of me, or on me. I had uh, I had 2 IVs, one in each arm. I had my pain pump. I had these 2 little catheter type things that would go on each side of the incision on my stomach. And it was attached to these little tiny little wires that went to like this ball of like medicine that had like this little carrying case bag to it. And what it did was it like let numbing medicine seep into, my incisions on my abdomen, like the first 2 layers of skin and muscle or something like that. Then I had a catheter for my PP. I had those little boots on your legs that pump up and down, and those felt pretty good. I had a thing on my finger to monitor my O2, my oxygen, and my heart rate. I was also wearing oxygen. Um, Goodness, I know I'm missing some. Okay, I don't know, but I had a lot of things. I was also on a lot of pain medicine. The doctor came in and was talking to my parents and said that the amount of pain medicine that I was on is the amount that they give cancer patients, and that he could not give me any more because, he's like, that's, my body would just shut down. So, um, the amount of pain medicine that they had me on for the first 2 days, like first 48 hours, um, I was taking an Oxycontin every 10 hours. My pain pump had Dilaudid in it, Um, I was taking 2 Percocets by mouth, 2 muscle relaxers, Robaxin by mouth. Then I had those pain things in my stomach, and I think that was all. But let me tell you, the pain, the it was a lot of pain. It hurt really bad to move and everything, but with that amount of pain medicine, it was it was tolerable. I remember Friday I wanted to be shot. Like I just asked my parents, I'm like, just shoot me, just shoot me. But it wasn't. I don't know. It was tolerable, but it still hurt really, really, really bad. But they still got you up and moving and everything. So it was like the perfect amount of pain medicine. Sounds like a lot, but it was a good amount. It was enough pain to I don't know, motivate you enough. I don't know, but definitely a lot of pain medicine. Now that I'm home, I'm taking 2 Percocets every 4 hours, and I take 2 Robaxin, which is the muscle relaxer, every 6. And that seems to be pretty good as long as I get it on a good schedule. And I have not felt loopy, crazy, tired, sleepy. The only side effects is, if, right after I take them, I might have a little bit of blurred vision, and that's about it. Um, the only thing I can tell is the pain goes away a little, for the most part, and it's very tolerable. I can get up and walk around and everything. So, yeah, lots of tubes and lots of wires. On Friday, the day after surgery, the doctors had me go downstairs to some kind of like Doppler test, I think. I don't know. Friday's a blur. So then the next few pictures is just the transport people taking me downstairs to do something. What they were wanting to do was some kind of test. I know they were like rubbing this stuff all over my legs. Um, just to get an inside visual and make sure that there was no blood clots and that everything was going good down there. Again, the doctor was talking about with my size, there is a higher risk of the blood clots. So he was wanting to stay on top of it, which was really good. But I don't remember this test at all. I remember, I remember my mom went downstairs with me, and I remember at one point like my leg was bent and then it just like flopped over, and I remember hearing like people giggle, but other than that, I don't remember this test at all. So as we stand today, in about 3 weeks, I see my surgeon for a follow-up appointment. I'm walking in the hallways, getting up walking 3 to 4 times a day. They want me to work up to walking a mile, but the only thing is it's raining, it's nasty weather, and my street's not very straight. And I tried taking a walk the other day, and it just wasn't very good. I'm sore after after you sit a while, and I need the walker to get up and get me started. And then after about 2 minutes of walking on the walker, then I can kind of stand up a little bit better and walk without the walker. Still on my pain meds I was telling you about. Um, I have family staying with me, and it is hard. You're not allowed to bend, lift, twist, or pull. You can only carry something that's 5 pounds. You can push, they said, as much as you want, within reason. It's kind of been hard getting everything in reach. Things fall over, and the hospital bed. It's comfortable. It really is. Um, but if you have the surgery, definitely get your ducks in a row first. Get things planned out. Um, just have things ready. Get your house ready. Get your family ready, and just have things to keep you occupied. You're gonna hurt. I have times when, I'm hurting and I'm uncomfortable. Last night I call them little mini meltdowns because, I'm just like, oh, yeah, my brace wasn't fitting right and it looked crooked and it was too tight and it was too loose and I can't get comfortable. The most of the pain, I can't tell if my pain's better or worse yet. I can't tell. Now, before surgery, I had what's called plantar fasciitis in my left foot, which I'm not going to explain it. It's just hurts in your foot. Um, that pain is gone, completely gone. However, in the place of it, I have a new pain, which they said is probably, since things were pinched down there, that it's just the nerves sending signals again. And they said it could take a couple of months for the nerves to realize, oh, okay, this is our new signal to work with now. But it's a tingling sensation. And when I have my toes pointed like this, it's okay. But when I start bringing my foot up like this, and oh my goodness, especially if I straighten my leg out at the same time, it is the worst pain in my heel. It will make me gasp and scream and cry, and it just hurts. I also have a pain in my calf, not my calf, my shin, the front part of your leg. So this is just a straight line the front of my shin. So I'm pretty sure that that's just nerve related too. One other thing I have after surgery is in my arm here. My IV had blown, and so it's not sore or anything up here. I mean, a little, but once you get up here to my wrist, it's like it follows the line of the vein, and it's puffy and it's hard and it's sore. It's like feels like a little snake under there. It's weird. So I've got to call into the doctor. I'm waiting to hear about that, and hopefully it'll just go away. But that's my surgical video. I hope you've enjoyed these past few videos. Hope they've kind of shed some insight into the surgery. I'm sure I will update you some more. Sorry I had to cram all this into one video. I really planned on having little tidbits of video that people would look forward to looking and watching, but no, I just figured I'd save it all to the end. I just kind of gotten, caught up with life. So, thanks for watching. And thank you very much for my mom for taking all of these pictures. She's just, the whole time in the hospital. So, couldn't have made this video without her. And my parents have been just an absolute godsend. Like, oh my goodness, could not have done this without my parents. They have been great. They spent every night, every day at the hospital. I almost said hotel. At the hospital. Mom did. Dad spent all the nights but one. Um, a lot of help. So now all I have to do is just rest, recover, take my medicine, eat protein, rest, walk. Doctor said that's my only exercise is to walk, and so that's what I'm gonna do. And hopefully we'll get life back on track. So wish me luck. Over and out.